You're watching NorthState Health, the North State's first local health program.
Good afternoon, I'm Tim Mapes. Thank you for joining us for NorthState Health, the only show dedicated to bringing you the information you need to live a healthier and happier life. Today's topic is Beyond Back Pain. We will be diving into the latest and greatest treatment options for back and neck problems. Now, our guests today are a few of the specialists from Shasta Orthopaedics in Reading. Now let's bring in Dr. Farzad Sabet, physiatrist with Shasta Orthopaedics in Reading. Now, Dr. Sabet, tell us a little bit about your training and your history and how you ended up coming here to the North State.
Well, thank you so much, by the way, for allowing me to speak. I started my training, my medical training in New York. I did a year of internship in general surgery and followed by 3 years of specialty in physical medicine rehabilitation. We're called physiatrists, or more appropriately, physiatrists. Mm-hmm. And after that, I went to Cleveland Clinic in Ohio to do a year of subspecialty in spine medicine, which is the only program at the time with a subspecialty specific to spine in treatment, in the conservative treatment of neck and back pain. Okay,
well, the people of the North State are very glad that you were here with your knowledge. So let's get right into the topic today. We are talking about back and neck pain. Yes. So let's start off by talking about some of the common misconceptions that some people may have about back pain.
Well, what I see very commonly, people come and they ask me, you know, there's something in my back that's broken and it needs to be fixed. And what I try to explain to them that with back pain, most patients do well with conservative treatment. Mm-hmm. Not everything, it's not like a broken bone where you need to mend it. Mm-hmm. Majority of the patient, 90% plus of the patient, they do well with conservative treatment. Okay. And they're not sure of the options that they do have available nowadays. There are a variety of therapeutic injections that help with neck and low back pain and prevents patients from having surgery and keeps them functional. Also, another misconception is as long as I take my pain medication, I can function and I can do well. And what I try to explain to them, especially in case of narcotic medication, you can become tolerant to the medication. You can develop resistance to it. There are some conditions that actually cause worsening of your symptoms. Nowadays, recently they have come up with the term opioid-induced hyperalgesia. Mm-hmm. And that is a condition where you develop hypersensitivity as a result of chronic usage of narcotic. Mm-hmm. So I encourage my patients to switch to non-narcotic drugs to get conditioned, get stronger, and prevent worsening of their symptoms. Okay. And we were able to offer them a variety of treatment options.
You're watching NorthState Health, the North State's first local health program.